Can you describe the OB-GYN experience here at Contra Costa?
If there's any deliveries, you're the one delivering. Obviously, with an attending, they're supervising and making sure everything's going appropriately. If any scheduled C-sections are happening, you're in there assisting. And we also have OB triage, which is a emergency acute setting. We'll be doing OB triage and admitting to the L&D floor. And sometimes we get emergency situations either with our patients that are already laboring or patients that come in that are breech and need to have a C-section urgently. So we have 2 ORs and 1 OR specifically for those situations. And then we also postpartum rounds. So the patients that we've delivered either that morning or the night before, we get to go check up on them and make sure that they're doing okay, and even say hi to their little babies.
For example, some of us will follow high-risk OB patients, will co-follow with either MFM or an OB provider. I have 3 patients that I co-follow, and I have the opportunity to be able to take part in their C-section or their delivery if I wanted to. And that, is one of the great things about our residency, is that we don't feel like we're managing these patients on our own. There's always support. And so we also have an our OB elective experiences where we get to work with MFM, rotate with them, and then other OB providers.
I think one of the greatest parts about L&D is you are often like the only resident on the floor. Every once in a while there's like 1 or 2 more, but typically like you are like the go-to physician on the floor for all of the laboring patients, which is really exciting because like the nurses come to you with triage questions, and anytime there's a delivery or a procedure, like you are the resident doing that. You get to do the IUPCs and the FSCs, and if there's vacuum deliveries, like you are always the person like standing there getting this baby out. And it is a really amazing experience to like have that much autonomy with a lot of like support from your attendings and a lot of hands-on experience that really helps you like grow as a physician. And for the people that end up wanting to do more of a fellowship, you get a ton of vaginal deliveries and also can do a fair amount of like primary C-sections if you end up doing the OB track. And then if you aren't interested and end up doing like a fellowship, you still get a lot of like hands-on experience with vaginal deliveries. So when you have prenatal patients in clinic, you can be like a really good support for them and help them through their prenatal period and like prepare them for their deliveries as well.
I absolutely love OB at our hospital, and I've been on several weeks of it right now because I'm doing the surgical OB elective, even though I'm not sure how I will practice when I graduate, but I think getting to train in the sort of largest breadth of practicing OB to primarying C-sections in urgent emergent situations will then let me give really good prenatal care if that's what I end up choosing to do. And also I just enjoy the surgical technique and getting to scrub in with our surgeons. I just did my 23rd C-section today. Getting to participate in every aspect of care, mom, baby, and being able to work with all of the different attendings is a really awesome, unique thing about full scope family medicine and the training that we get here. The surgical OB elective is something a little bit new, and it used to be that sort of every family medicine resident at our program would train in C-sections to the level of primarying C-sections if their surgical skill allowed. And now it's more that our family medicine residents, the priority is getting really good at managing labor and delivery on the floor, vaginal deliveries, postpartum hemorrhages, those types of complications, and then maybe assisting in C-sections, but not necessarily primarying. And so the surgical OB track and elective is to let residents who might do an OB fellowship or would be interested in doing C-sections in the future get more experience. And it's a really cool elective. You get to work with family medicine OBs as well as OBGYNs doing C-sections. So you see lots of different techniques in the art, although we all practice the standard C-section that is data-driven and safe. As a surgical OB resident, you are the resident who is gets first dibs on any C-section from 6 a.m. to 6 p.m. Monday through Friday, any scheduled or non-scheduled urgent emergent C-sections. And so you will go with the attending and primary or assist depending on the situation and your skill level. And you get a lot of practice then knowing sort of the indications for urgent C-sections and also different things to look out for. If it's a third repeat C-section, you know how to deal with adhesions, you know how to make bladder flaps, you do bilateral salpingectomies, you might take out a cyst if you happen to find it there. You get really comfortable with fascial closures, with all sorts of different skin closures, and then you also manage those patients. You follow them every day on postpartum, so you really see what happened. If there was a postpartum hemorrhage, you're following not just their hemoglobin, but how their wound healed, depending on what type of packing you might have placed, and all sorts of different things like that. So it's a really cool, very full scope experience of surgical OB. Another thing I love about Contra Costa, and something that was very important to me when I was choosing residency programs, is the level of abortion care that we get here. It's an opt-out program, meaning everyone gets a baseline training unless you choose not to. And then if you're particularly interested, you know you'll be providing abortions when you graduate, then you will get trained up to improve your numbers and go to later gestational ages. And so I was able to do sort of different levels of medication and surgical abortions, both in clinic at our county clinic, as well as at Planned Parenthood, as well as in our OR. And I feel like the level of respectful, trauma-informed care that is provided in our county is really inspiring. And I am so glad that I had the opportunity to be part of these women's journeys.